Hello everyone, my name is Colomba Mo and I'm very happy to be with you in our Heroes in Health. The doctor I'm going to introduce you to today is the Executive Director of Franklin Medical Services, the first Vice President of West African Private Healthcare Federation of Ghana. So please be comfortably seated and let's get started. Welcome, Dr. Lynda Decker.
Thank you.
We're very pleased to have you today because I know we were supposed to have you before we couldn't make it. So I'm just happy and I hope you're going to enjoy this Interview with me because I'm going to check into details into your life. So let's start with, tell me about your high school studies. How did it start? Your dreams when you were still a child, and tell me about the movement.
We will have to go very far back, many years. But as a child, I always wanted to help people. And I loved to talk. And so I knew very early in life that I wanted to be in the medical space. Both of my parents were pharmacists.
Okay.
My mother was one of the first to graduate out of the college in Ghana at the time as a pharmacist. And she met my dad in school. He was a little bit ahead of her. And of course, they got married. So I grew up, one of my first memories was being at work with her and having bottles of pills everywhere in her workspace. And so I think that the idea of being in the medical space was something that was almost second nature. I grew up around medical people.
So what happened after your studies, university?
So, of course, in school, I did well in school. I passed through school without a lot of effort, but it was always important to work hard. I wouldn't call myself the first student to remember everything the lecturer discussed, but what I would do is at some point to try and quickly go over what I've been taught so that at least I could remember something and sound intelligent in class the next day. My parents were very encouraging. My mom would say, oh, just do the best you can. But in saying that, it gave me more courage to feel that I would not be judged if I didn't perform to the utmost, but it also gave me inspiration to work harder.
I love this information.
And so that's the way I passed through school. I was a science student. In my time, we would write what we call the common entrance. I don't know what the equivalent is in some of the West African countries. So that is your passage into secondary school. I was a science student, of course. And that is the way I started my journey.
Yeah, it's a very important information because as the first Vice President of West African Private Healthcare Federation, we can think that we always need to be bright in school, to become someone great in life later on. But I think we just need to be encouraged as you've been encouraged. So
I do think that, and throughout medical school, I remember my first year in medical school, it was a scary experience because you look around and think, oh my goodness, this person is smarter than I am, or that person is smarter. But what I found in medical school was that if you paid attention to detail, you would do well. And so because of that, the girls used to do better in terms of performance. If we were asked to present a case, we would pay more attention to detail. So I think to excel, you need to be detail oriented. So it wasn't necessarily the best mathematician or the best biology student, but if you paid attention to detail, you would perform well.
And after school, did you work as a volunteer into an organization, or did you directly go went into an hospital?
I don't remember volunteering in that sense. Volunteering in the sense of an occasional medical outreach, but I don't remember taking a year off. And if, you know, the opportunity did come, that would have been a good thing. But I was always eager to learn, so I would learn at every opportunity. After school, I worked within the government, set up the public system for about 2 years.
Okay.
And very quickly, I realized that...
Did you had an exam before getting there?
No, actually, no. So I passed out, in the sub-region, we have something called MBCHB, which is you are a general practitioner.
Okay.
So I passed out with that. In Ghana, what you do, and I think in a lot of the West African countries, Nigeria maybe, I don't know what the Francophone countries do, but you have, after school, you have a year's housemanship, and then you start working as a young or a junior doctor in a teaching hospital. And if you're lucky, you can work for about 2 years in a teaching hospital where you're supposed to gain most of your experience in pediatrics, in obstetrics and gynae, in general surgery. And the idea, and medicine, internal medicine. The idea is that in our setup, you are being equipped to be able to work anywhere in the rural areas and know a little bit about everything to save the most lives. So I think that was what was unique about the training that I had in my time, and we're talking about 30 years ago. And I think the training is still similar now. So I hope that answers your questions. Yeah.
That's good. What about, can you tell me something about the healthcare situation in Ghana?
I think Ghana is very much like every other sub-regional country. The government is responsible for taking care of most of the population. What we are blessed with for the past 20 years is that we have a national health insurance scheme that takes care of most of the population. And then the private sector comes in to provide some sort of support for the public system. As we know, in the sub-region, about 50% of patients who need healthcare would go to a private provider, either a private lab or a pharmacy or a private hospital or clinic as a first point. And so I think that this situation exists in Ghana, as with all sub-regional countries, where private sector provides 50% of the care to patients.
Is it the reason why you've moved to the other side, or are you?
Well, I moved to private sector because even though I loved my work in the public sector, I knew that I couldn't bring about a lot of impact or change. And the sort of impact I was looking at was to change the mindset around how patient care is delivered. I found that the public sector was overwhelmed, so it was difficult to give your utmost and give excellence in care. So one of the reasons why I transitioned into private sector was I felt that it was a space that I could control, and it was a space that I could make a difference in. The beautiful thing about how my life has turned out, how my professional life has turned out, is through my work within the private sector in Ghana, and of course in FOAPS. You know, it's a full circle, because now our partners are the public sector, and we work hand in hand to try and bring about universal health coverage. And I think it's a beautiful way in which life sort of turns out.
How long have you been working for them? I mean, with them, the private sector?
So I started Franklin Medical Services, which is my practice, in 2007. So I think it's about 17 years.
Wow.
And I joined the Healthcare Federation of Ghana in 2017 at its inception. And I think within that year, the West African Federation also had its first annual general meeting. And I think that as a member of the Healthcare Federation of Ghana, you are co-opted into the regional federation as well.
All right. And can you tell us about the projects of the healthcare? But before that, tell us about the challenges you've met since. Since you've been stepping into the federation.
Oh, I think that the work or the mandates of the federation is quite huge because if I can talk about Ghana, it's supposed to be a private sector platform that is representative of the value chain of healthcare providers in the country. We have been in existence since 2017, and it's a work in progress where we are still bringing in professional associations and providers along the value chain. So membership drive takes time, and I think that it's something that takes time because it's built on trust. What is the value that I'm getting from joining a private sector platform, and how will it impact what I do? And I think it's a daily conversation that will continue to go on. So I think the main challenge has been that. The other thing has been to engage our partner, which is the public sector. I think that the public sector is a complex platform, and our primary contact in the public sector is the Ministry of Health. Governments change, officers change, and so it's important to maintain dialogue, to maintain trust. What is it that we need from private sector? Of course, we're going the journey of the healthcare journey together. So it's important to constantly engage, to be able to get to, we're all trying to do the same thing, but using different pathways. And so it's important to constantly engage.
Wow. What do you think about medical tourism?
I think medical tourism, and when I talk about medical tourism, I refer to the inward transfer of patients, because we've always transferred patients out.
Yes, out.
And I think the beauty of medical tourism in the context of our conference, in the context of now, is we are looking at centers of excellence within the sub-region and within the continent that patients can travel to obtain care. Now, people travel across borders for care, firstly because of the perception of better care than they would receive wherever they may find themselves. But I think the other object we overlook is confidentiality. If I live in Ivory Coast and I'm a member of government, I may not want people within the country to know that I have a particular ailment. And I think the beauty of our sub-regional integration and sub-regional collaboration in medical tourism would be that you can travel to Togo or you can travel to Ghana. And I think that as we grow this part of the medical service, countries will benefit from revenue, countries will benefit from improved services. So I think it's an amazing thing for the sub-region.
And do you think the facilities can easily cover up the whole country?
I think that we have enough resources within the sub-region to satisfy our medical tourism needs. For this reason, FOAPS would want to lead in facility mapping and facility accreditations so that patient quality, service quality, patient safety, and other things that would improve patient confidence in medical tourism would be improved.
Wow. What about the poor? You know, there are people who cannot have easily access to facilities in our region, especially in Africa, you know. So how do you do to deal with this?
You know,
as a federation?
It's an interesting question. And I think one of the things that has come up during this Congress is that the government actually is responsible for as much of the care of citizens as it is possible. So I think that private sector comes in at a different level. Government looks after those who cannot afford, and looks at ways in which they can finance that. And I think that is where health care or national health insurance comes in. I think the role of private sector is really to add on and complement for services that cannot be accessed through government services, or provide services that can be facilitated. So that if you're waiting for queues within the government service or the public service because it is on insurance or it's at a slightly lower price, then private sector can offer you a service that can be facilitated to improve your turnaround times. I think that that's our role within.
Because I wanted to ask you, what is the real difference between the public sector and the private one?
I think that is the main difference.
The law, the price, I mean.
Oh, pricing.
Yeah.
I think that pricing is an interesting thing because it depends on where you are, and even within a country, it depends on which region you are in. So in Ghana, and I'm sure it's the same in Nigeria, and the same in the sub-region, there are price differences depending on how close you are to the main city. I mean, your overheads are higher if you are in the main city compared to someone who lives on the periphery or lives in the countryside. So it is. However, what we have in Ghana is that we have private sector providers who accept national health insurance. And what that means is that they are able to provide pricing that helps the ordinary person access some sort of reasonable care. So in terms of pricing, I think pricing varies from place to place.
All right, so let me ask you another question. As the first Vice President of West African Private Healthcare Federation of Ghana, how do you work to improve the healthcare situation in Ghana? You can talk about the projects you also have.
So I think one of the main things we do is advocacy for our members. What sort of things can we do for members to improve what they do? I think that in advocating and negotiating for tax breaks and the like, then we can reduce the cost of care to patients. The other thing that currently we have several projects that are in the pipeline, including we have started looking at a members directory which would feed into the regional mapping exercise. But what that would do also for members would be to attract investors, so that if you're an investor coming into the country, you have an idea of who is in the space that you are interested in, and whether what we do is to do matching for businesses to see, how investment can be directed. But in a roundabout way, when you have the right partner, it reduces the cost of care, because we all understand that borrowing locally can be very expensive, and healthcare practices and services are business entities that need funding to be able to run. So I think those are a few things that we are, including supporting our members to improve their books through management consulting and services that can position them for investment.
We really appreciate your intervention, Doctor. Please, if you had a word to tell the population, what would it be? You can just look out right the camera.
I would say that there's a lot that the health sector, the private health sector is doing to improve the quality of care. And it's all with you in mind, with the patient in mind. And so we should continue to invest in our various countries, because it's investing in our countries that we improve infrastructure and improve our situation. We are not going anywhere as healthcare providers. I think that we trained and we're here to stay, and we're here to improve the lifespan of citizens. So I think that would be my takeaway, that we are here to serve.
Wow, thank you. We were with Dr. Lynda Decker, and she's the first Vice President of West African Private Healthcare Federation of Ghana, and we have learned a lot about Ghana's federation. We're so glad. I'll just tell you people, see you soon and stay healthy for next time.